So what is HCG used for in your IVF cycle? HCG is typically part of the trigger medication. So you'll either trigger with just HCG, or HCG can be combined with Lupron for trigger as well. The HCG triggers ovulation. So once we see that everything is ready, your follicles are at a good size, they're mature, then we would give you either HCG on its own or in combination with Lupron to trigger ovulation. How many days do you take your trigger shot for? So depending on the clinic and depending on your protocol, it can either be taken one time at a very specific time that they'll assign for you. It's the only injection that's super time sensitive. So if they tell you to take it at exactly 11:20 p.m., it's because it correlates with the time of your retrieval, which is typically about 36 hours later. So that's the one that's very, very time sensitive. So typically it's only taken once. Sometimes they'll have you take the HCG at a certain time, and then a couple of hours later, if Lupron is part of your trigger, they'll have you do the Lupron a couple of hours later. Sometimes if your trigger is Lupron only, they'll have you do it at two separate times, but the HCG trigger is typically only done once. What happens if you miss your trigger time? This is a huge complication. That's why they stress to you that it's extremely time sensitive and to take it at an exact time, even if, we know that there's a little bit of wiggle room, 2 to 5 minutes. There are, certain limitations that we put on it. We want to urge patients to do it at that exact time, because oftentimes if someone is missing their trigger, it will throw off the timing of their retrieval. You can ovulate before we get a chance to get in and take all of your eggs out. So it is extremely important to do your trigger shot at the right time so that we're not missing ovulation and messing with your egg retrieval procedure. How is HCG administered? HCG is administered one of two ways. So it can be done subcutaneously like the other IVF medications, but some clinics prefer it to be done intramuscularly. And so it would have to be administered in your buttocks, in your gluteus muscle, since that's the largest muscle. So depending on your clinic, it could be done subcutaneously or intramuscularly in the buttocks. Are there any side effects to taking the HCG trigger shot? Typically, we hear from patients that they're having headache in response and cramping in response to their trigger medications. This makes sense because as you're ovulating, you're probably going to feel that cramping, and headache in general is known to be one of the main side effects of HCG.